Kris Urv-Wong, and I work as the program manager for the Health Technology Assessment Program. I work for the State of Washington Healthcare Authority. What I try to do is to find data and explain it to people so they can take action with it. So I provide information for both my director and for a lot of the agency medical directors that we work for as well. I have a master's in healthcare administration from the University of Minnesota, and there we were pushed very hard to be both qualitative and quantitative analysts. And it started out with developing your own databases, doing your own basic research, all the way to taking that data into analysis and then doing a write-up of it. It was a great learning experience, very practical, very hands-on. If data isn't robust, you can't do major analysis on it, and you can only take it so far. And to understand the shortcomings, especially in the healthcare field, that you're usually working with secondary data as opposed to being able to collect your own data. And I liked it a lot better once they came out with the GUI interfaces, so that you actually spent more time doing analysis of the data as opposed to trying to grab the data. I've worked with people in the different programs and even in different agencies that are very, very good at what they do. I can roll around in my data and have a basic understanding of what the socio-demographics are of the people and how to put things together. But I can't always do that for other programs. So it's such a boon to have individuals who work in the other programs be on the same page as I am. And it's, as I've said, a pleasure to work with people who know what they're doing. I think the big thing would be to do practical knowledge. Take a project and take it all the way through, as opposed to saying, oh, I'm putting a database together here, and 3 months later saying, oh, I have another database and now I'm going to do analysis. Having to work and put an entire project together, from coming up with the concept, writing a data dictionary, actually loading your own data, and then doing the analysis, I think is the best way to learn, because you're going to know your own data better than anyone else. And it helps in the manipulation of it. You'll know how far you can go with it and you can't. And I think it's a good, practical, hands-on way of working things. And you can't blame anybody else for bad data. It really is a fascinating field. And I tend to call myself a data geek or a data wonk, because you can really have a lot of fun with it. Sometimes people glaze over when you tell them about it. My mother still doesn't understand what it is that I do. But if you have an analytic mind, if you like getting to an answer, then it's a perfect